All right, we're live.
All right, good morning. This is the Senate Health and Welfare Committee. It is February 23rd, and we've been on the floor for about 2 hours, not quite 2 hours, so we're having a shortened meeting this morning. I thought it would be useful. We have Katie here. I don't know whether Jen's going to show up, but we also have Nolan, just to talk about or look at um, possibly a list, or if we can get into some of the bills, look at the bills that we have that have come to us from the House, because we do want to establish some priorities relative to House bills. And I do know, and Katie, you can help me with this one. I do know that the child care bill we will be getting, and I also know the child advocate, family advocate bill we will be getting. And so, but I don't know what other bills we have. Not all of them that we have been sent to our committee are actually up on our webpage yet. So, Katie, I'm looking for. I'm
There's some
setting my
answers.
helpline out. Yeah, good.
Sure. Katie McGlynn, Office of Legislative Counsel. So H-171 is the child care bill. That's up for second reading on the House tomorrow. So if second reading is tomorrow, third reading is Thursday, you might see the bill by Friday, or at least we'll know what's in the bill by Friday.
Yeah.
And then the Office of Child Advocate, the House Human Services Committee has begun their work on it. They've taken quite a bit of testimony and they've looked at one draft, but I don't really have any other information besides that. I think there's still more work to be done and it hasn't been voted out of committee yet. So that
Do you
one
have a
could
number? Is there a number on that bill, or is that a committee bill?
There is a number. That's H-265.
Oh, okay. Yep, that's right. I've been getting emails about that already. Okay, that's good. All right. So do you have a sense of any other bills that have been sent over to us from Human Services or on mental health? I know there are some from mental health from the House.
Yes, you do have H-46, which was a mental health bill coming out of the House Healthcare Committee. You also will likely be getting H-210. That's the health disparities bill.
Right.
And that is up for second reading on the House floor tomorrow and third reading Thursday.
Oh, so that one should arrive about the same time as the child care bill.
If everything goes according to plan, I would assume they would show up around the same day. Yes.
And H-46 is the miscellaneous provisions bill.
Yes.
The miscellaneous mental health. All right. Good morning, Jen. Are there any others, Katie, that in your area that we'll be seeing?
Not that I worked on, but I believe Jen has others that she worked on.
All right, good. Hi, Jen.
Morning.
First of all, I want to say thank you to you for acting so quickly on the proposal amendment that I'd like to offer on H-315, and we may take a minute with the committee at the end of today. We'll just take a few minutes just to talk about what that is. But maybe you could share with us House bills that have been referred to our committee but haven't shown up yet, or that you understand are being worked on and will get here sooner or later.
Before Jen, just here, I'm going to turn my video off because I'm eating and my internet is unstable for some reason. I don't know if you can hear me, but
we can hear you.
I'm turning my off.
Well, you know what? You will probably hear you better. We'll hear you better with the photo off. So, but that's fine. This is a pretty light day for us. So, go ahead, breakfast time.
So I am keeping an eye on the House floor because I do have a bill coming up.
Okay.
Next, but I don't know exactly when next is going to be. So the bill that has been referred to your committee, I believe, although it sounds like you haven't received it yet, is H-104, And that has to do with the interstate practice of healthcare professionals. So it's setting up a working group on the facilitation of interstate practice using telehealth.
Okay, I saw that one and I wasn't sure what that was about. So that's helpful to know. So where is it right now?
Well, according to the web, it's in your committee, but
Yeah, okay, so we don't, Nellie, maybe you can track that down. 104 is in our committee. It's right there.
okay,
Yep, we
great.
got it. All right.
So that's
Is there any-
H104. And then the other two, so H430 is the one I'm waiting for today on the House floor, and that would expand eligibility for Dr. Dinosaur to pregnant individuals and children who are undocumented immigrants. So people who would be eligible, who would be financially eligible, but for their immigration status that makes them ineligible. And it would start out with sort of a transition year and then have information on cost included in, although there are already estimates that no one can tell you about, but have information presented as part of the FY23 budget process with an eye toward starting that coverage with state-only dollars. We would not be able to get federal match because of the immigration issue.
Right.
But looking to start that for starting on July 1st of 2022, but doing some grants to providers and outreach through groups that work with migrant communities and undocumented immigrants in order to have them get some coverage or get some treatment as if they need it within this transition year. So
All
that's H430. And then there's H153, which is looking at some issues around Medicaid reimbursement rates to home and community-based service providers. So DAs, SSAs, also choices for care and similar services outside of choices for care, like adult day rehab and things like that. And looking at what those rates look like. Some of the language that was passed in or was in this committee last year when you looked at the Older Vermonters Act, but that was taken out in the Appropriations Committee. And so again, it has the version passed out of the Human Services Committee would sort of start toward implementation of increases and annual COLAs. The amendment from the House Appropriations Committee would back that off to be more of informational purposes.
Okay, so that one's from Human Services Committee, and the
Right.
Dr. Dinosaur is from the Healthcare Committee.
Right.
Okay.
Yep.
All right. And Katie, the Health Disparities Bill is from the Healthcare Committee. Yes, okay.
Mhm.
Are there any other bills that we should be expecting, do you think?
Not that we know of at the moment, but we never know.
You never know. Okay, so where is H153? Well, right now, H430 is on the floor right now, and you're
H430
monitoring-
is up for second reading today. H153 is up for second reading tomorrow. It's on notice today.
All right. All right, well, so good. This gives us a little bit of time to do the things that we need to do this week, and sort of understanding, first of all, on our oversight for gubernatorial appointments, but then also to get an update on some of the concerns that we've heard about from hospitals, to get an update on the all-payer model, and then the report I have, just FYI for the committee, the report that's scheduled on Friday from the Green Mountain Care Board is one that we asked for in this committee on equitable reimbursement. So that one, and by the way, that one is a little bit complex, so we'll just begin to dive into that one on Friday. And Nolan, you're going to have to help a lot on that one with us. That it is complex, and we're going to sort of split it up into maybe 2 or 3 different days looking at that report. So in the meantime, as what I would ask for is for us to go through some of the Senate bills that we have and think about those bills that are key and important to us. Relative, I think most relative to healthcare reform. I think we've heard that that's important, and Jen is putting together some pieces for me that we can decide what to do with when we get there. I know that the S-120 is a bill that's important to Senator Hooker and Senator Hardy, and I like it too. So we'll have to we'll see how to deal with S bills when it's probably time to be devoting ourselves to H bills. Maybe we can put some things together. That's all I'm thinking. All right. So, I think what might be helpful, we don't have the reporters of the bills we don't have them scheduled in on our agenda. But honestly, we have 1, 2, 3, 4, 5, 6, 7 H bills. If it's possible, I just for each of you, Katie and Jen, to give us kind of the high level read of what we can expect to see in those bills, not pulling the bills up at all, but just maybe your understanding of what currently exists in those bills, knowing that who knows, amendments do happen. So let's just do that for another like 15 minutes so you can see it's not a big deep dive. So who is under the most stress with a bill on the floor? Yeah, Jen, are you or Katie?
I do have a bill on the floor, on the House floor. I'm watching it on my other screen.
Well, we'll alternate, and so that it does, unless you'd like to go through your bills sequentially, you each have 3 bills. So.
Okay, I don't know, Katie, do you have something on the floor too?
I don't. I was going to say whichever order is best for you is fine for me. I would maybe suggest that going through the childcare and the health equities bill at this point is maybe a little premature.
Okay.
I think you might want to wait to see what happens on the floor if those change at all.
All right. That would be a super high level then for those two. Yeah. Okay.
All right, well, I'll start with H104 because we know you have that one.
Yep,
so
we
we know
do.
what it looks like. And that is the facilitation of interstate practice using telehealth working group. It has OPR convene this working group with people from the OPR professions and the Board of Medical Practice professions and healthcare professional organizations, insurers, other interested people. And they're supposed to come up with and sort of look at ways of making it easier for healthcare professionals to deliver services to Vermonters using telehealth without getting the regular license here. So they're directed to look at things like creation of telehealth licenses, waiver of licensure, national licensure compacts, regional reciprocity agreements, things like that. Of course, we can only really affect what Vermont does in the way of licensing or not requiring licensure of out-of-state professionals. We can't, without some kind of reciprocity agreement, affect how other states would treat Vermont licensed professionals. So that's some of the consideration as well. And it gives a list of things to be considered. And then it has the working group reporting by December 15th of 2021. The director of OPR would provide the working group's findings and recommendations to this committee, the GovOps committee, and your House counterparts.
Okay.
That's basically it. And just by way of background, it came to it was introduced in the House as a bill that would allow a clinical mental health counselor or similar licensee in another state who was licensed in another state and been treating a Vermonter in a state in which when they were both together, to continue treating that patient if the patient came back to Vermont without having to get licensed here. And there had been interest in looking at that issue more broadly across different provider types, and also looking at whether there should be some sort of licensure or other regulatory processes involved. So that's where this sort of grew out of that.
Cool. All right. That's great.
So now you are interested in, so we did kind of, I talked a little bit about H 430, but H 430 would allow undocumented immigrants who are, so children up to age 19 and pregnant women throughout their pregnancy and for 60 days postpartum to receive Dr. Dinosaur-like benefits paid for with state dollars. And the description I'm giving you is sort of the combination of what passed House Healthcare for the bill as introduced, and then what the Appropriations Committee amendment would do. The amendment was supported by the Healthcare Committee on a 10-0-1 vote, I believe. So, so it looks like that's what
Okay.
would
Yeah.
come out. And so one of the things it does is appropriate $1.4 million in one-time funds for this kind of transition year, as I said, to get those people connected to treatment if they need it, connected to medical services, and the providers get paid for the services that they provide to that population before the coverage itself would kick in.
Okay, and that bill is the one that you're keeping an eye on right now.
Yes.
Okay.
Right,
All
so
right.
that's up for second reading today.
Yep.
And then the other one is H 153. And that would, so that one also has an Appropriations Committee amendment. So let me actually
Yeah.
just pull it up. And
That one looks, so right now, what you indicated earlier is that one will be mostly a policy bill without specific rate recommendations.
so it wouldn't put something into place that would go into effect automatically, which had been the, sort of the Human Services Committee wanted the Secretary of Human Services to establish payment rates and adjust them and have adopt rules for an annual inflation factor. And so the Appropriations Amendment kind of revises that to have the Secretary determine payment rates that are reasonable and adequate and adopt rules, but the rules are really the methodology for how they would determine these rates. And then it would have the Secretary redetermine the payment rates at least annually and report them and the amounts necessary to fund them to the committee's jurisdiction, including this committee. So kind of do all the calculation, figure out what, based on the methodology that's adopted, the rates should be and what it would cost to get there, but leave the actual financial decision-making for the legislature to do.
Okay. Nolan, have you been involved in that one?
Yes, he has. And let me just tell you about one more piece, which is that there's a rate study similar to the rate study, but a bit broader, that was called for in the legislation from last year that would go into the rates themselves and look at how they're determined and look at ways to make them more aligned with rates from other payers and things like that. And there is some fiscal implication to that. So I'm going to, and to the rest of it, actually. So Nolan has, I'm sure, some stuff to tell you about.
Do you want to give us just the high level look at that one, Nolan?
Yeah, I mean, I do have fiscal note on this, and I talk about, let's see, there's no appropriation in the bill. I'm just trying to read, I'm looking at my note, trying to remember.
Yeah.
But the House Appropriations was planning to put $200,000 gross or $98,940 in general funds in the budget for the rate study and rate setting needs identified by DEVA in order to do this work. So there's no appropriation in this bill, but there's money in the budget around this.
Okay. I'm sorry, I didn't mean to cut you off.
No, what else? We did do a little bit of work to try to estimate what rate increase might look like. And I talked a little bit about that and it's very targeted to specific services. like ones, and the committee was targeting services specific to, Representative Wood said it better, will say it better than I would, that were more towards people services. Like, so it would go towards like rates and stuff, but not towards like Meals on Wheels and those kind of things. And the estimate is, and this is and back of the envelope based on the information, was every 1% increase would be approximately 4.5 million gross or $2 million in general fund.
Yeah, I think that's pretty consistent what we've heard in the past, I think.
Yeah.
Yeah, and then, so this would effectively, what we're talking about is sort of base rate, base pay type increases for some of the services that we're talking about.
It's increased rates. I wouldn't call it pay. I would call it increased rates for services.
Yeah, okay, but it's like a base increase.
Correct.
That'd be ongoing.
Well, this looks at what it would be. It doesn't require them to do it.
Yeah, okay. All right. This is good. This is something that we've been wanting to get to, so it's nice to know that that's happening. Okay, so let's, Jen,
Madam
those
Chair,
are-
can I just
Yeah.
ask a clear?
yeah, no, go
My
ahead.
internet,
Go-
I'm sorry. I don't know if you can hear me, but can I ask a clarifying question? Okay. My internet today is really bad. Nolan or Jen, this would be for, would it include long-term care facilities? Or
No,
is it-
there's
it's just-
already, right, there's already a rate setting process for nursing homes. This is specific to home and community-based services, but a fairly wide spectrum of home and community-based services.
So it would include home health services or?
Yes, yep.
Yes, okay, great.
Yes,
Thank
it would
you.
include home health services, both choices for care and non-choices for care.
Okay, great, thanks.
Good question. All right, anything else on those three bills? So we'll, I think unless I hear differently, I hope, theoretically, we will get these bills, so let's hope we do. We'll have them up for, with the reporters in. Okay, so Katie, you have some bills that are still in fluctuation. So go ahead, make your choice. Pick your bill.
Okay.
You've got 4 bills. I said you had 3, you have 4.
Oh, I think it's 3. So right now you have, excuse me.
Childcare, advocate, miscellaneous, and disparities.
Oh, I wasn't counting the advocate since I hadn't made it out of committee yet, but
All
yes,
right,
I
okay,
am also
yes,
working on
okay.
that one.
Yeah,
So you do have H46, which is the miscellaneous mental health provision bill. That has a section in it just about notice before a person is admitted to be a voluntary patient. That person under current law has to give their consent in writing. And there are different items that have to be in that consent form. And then item that was added by the healthcare committee was that the person understands that inpatient treatment may be on a locked unit and requested discharge may be deferred if the physician determines that the person is a person in need of treatment, which is a statutorily defined term to mean that that person is considered either a danger to self or others. There's a section on notice of rights that the head of hospital is to provide, including by posting excerpts from relevant statutes, but just information informing patients of their discharge rights and other rights. That's all in existing law. And the addition is that this notice would include that presenting a request for discharge or for an application to have the patient's status changed from involuntary to voluntary status would have to be part of this notice of rights that patients receive, how to change their status. And then there, excuse me, there's language on reporting. This bill would direct the Department of Mental Health to oversee and collect information and report on data regarding the use of emergency and voluntary procedures, meaning seclusion and restraint, for patients who are admitted to a psychiatric unit. And this would be regardless of whether the patient is in the care and custody of the commissioner or not. And then the last part of this bill, there in 2018, there was a report that was required, and there was various data collection responsibilities that was part of this report. So one of the data, this report was set to expire. It was to be an annual report between 2019 and 2021. And this pushes that, that date back. So you'd continue to receive this annual report through 2023. But one portion of the report had to do with the involuntary, emergency and voluntary procedures that were performed in emergency departments for individuals who are seeking psychiatric care. And my understanding is that this data just wasn't available to emergency departments. So that particular portion of the report would be removed, even though the report itself had an extended deadline. So that's it for that particular report, bill. That was H46. And then to try to give you a high level of, I guess we'll do H171, that's the child care bill. Let's see. So it's had kind of an interesting history as it's moved through the House. The House Committee on Human Services passed out a committee report, and after that was passed, we started to learn more about what was coming from the federal government through the American Rescue Plan Act, and that created a need to reevaluate the money that was in the bill, and maybe take a little closer look to see what federal dollars might be available for some of the things that the committee was looking to fund through their report. So the committee initially issued an amendment that was offered by all of the members. And then procedurally, it became a little bit complicated. So in the end, what we have is an appropriations committee amendment that it's a strike all, and it includes all of House Human Services amendments, plus a few of the amendments that the appropriations committee wanted to make. So just kind of an unusual process for getting the bill to the floor.
It is unusual, but at least it didn't get folded into the budget. That's what always happens to all of our work. But,
right. The last time that the child care bill moved, what year was that? 2018. That bill on the Senate side ended up in the budget. So to just give you kind of an overview of what is in the Appropriations Committee amendment, which incorporates both human services and appropriation changes. Let's see, there's a legislative intent section. Then there is a section on the Child Care Financial Assistance Program. The kind of important takeaways there are that there is a flip. If you remember the Child Development Division talking about the 5-year redesign, there's a flip in the way the subsidy is structured this year. So currently it's the subsidy is based on each individual child, and this will be a flip so that a family gets a benefit regardless of how many children are eligible for the subsidy within the family. Also in this language, every family participating in CCFAP up to 150% of current FPL would no longer have a copay under the new proposal. And it also increases the upper income limit to 350% of current FPL. And then there are some changes in the way that providers, payment to providers under the CCFAP program are calculated. But now that I'm thinking about it, a lot of the changes that the Committee on Human Services originally made became, instead of requirements, permissive. So there is language about using the market rate survey and using the most up-to-date market rate survey to provide payments to providers. the original version had shall consider or shall reimburse according to this formula. And now the language is that the department may consider reimbursing in following this formula. And that was a change to reflect the uncertainty of what that cost would be. And also that was a change of not wanting to obligate funds, especially when we're not sure if the federal funds could be used for that purpose.
It
So
sounds
that-
like will we be getting back into the whole market rate analysis? Have they made changes to what we had in 2018? Or is this-
You might hear a little bit about this. This wasn't so much about, this was about, I guess the concern is always, how old are the market rates that we're using?
Yeah.
This survey is done every 2 years, although I think the committee heard testimony from DCF that they might be doing it every 3 years now,
Yeah.
that the federal law has changed and the market rate
Yeah.
survey is every 3 years. But regardless, there's always a lag of which market rate survey we're using. Like I was trying to look, so I have a little sticky note because I can never keep track of where the rates are, but so the
Okay,
fiscal rate-
we're probably going to be getting into too
Okay.
much detail, so
too deep a
let me
dive.
just, I think we get it. I think we understand now there's some changes that have been made and we'll have to go through the whole thing. That's all.
Sure.
Let me ask one last question on this one, because I want to kind of allow for you to move ahead to the other bills that you have. But the House Human Services, have they reviewed the appropriations strike all, and are they, they okay with that? Do you know?
Yes, they took a straw poll
Yeah.
this morning to approve it.
Okay. All right.
Would you like me to keep moving with the childcare bill or?
Well, I don't know. Can you do it at a somewhat
Higher
a higher
level? Yeah.
level? Yeah, I think
Um,
because we're going to forget all the details that we've just heard.
Sure.
No
So
question.
there's language about the Bright Futures information system and creating an end user group. There are 3 workforce development programs that are created, 2 scholarships and a loan repayment program. 2 of those 3 programs are set to repeal in 2026 under the bill. Let's see, there is changes to the Building Bright Futures responsibilities. There is the creation of 2 working groups to look at how to spend the new federal monies that are coming in through the American Rescue Plan Act. There is a financing study from looking at the financing of the childcare system generally. And then there's a systems analysis study to look at kind of governance issues within childcare. So that's the high level. That's the very, very high level of
No,
that.
that's
of the
good.
bill.
I think that's helpful. It gives us, that I think is very good. We get it. We'll know what to look for.
Should I move? Oops.
Yeah.
So could I just ask?
Wait, go ahead, Senator
Thank
Hooker.
you, thank you. About the governance, Katie, is that
Mhm.
like moving the system into?
No, that's not what is meant by governance. This is more like the administration and operation of the system.
Okay, so the idea of moving from DCF to education is,
No, this isn't part of it. Yeah.
Yeah, okay.
In fact, the original bill as introduced used the word governance, and we that word was taken out for that very purpose, and instead using the word systems analysis instead of a governance analysis. So that wouldn't be confusing.
okay, thank you.
Sure.
I was confused.
I
Good question.
used the very word I wasn't supposed to use.
Systems analysis. That's good. All right. Why not go through the health disparities briefly?
Sure. Maybe it's better to kind of give you a conceptual picture of what is happening with that bill.
Sure.
So the bill is introduced, created an Office of Health Equity, and it created a director of that office, a director of health equity. And the committee heard a lot of testimony. This office would have been within the health department, was what was under consideration. And the committee heard a lot of testimony that the Department of Health just didn't have the capacity right now to take on this new office, just given that we're still in the midst of a pandemic. So the new structure that the committee came up with was to recognize that there is already an executive director of racial equity that's doing a lot of work in this area, and to have that individual, in this case, Susanna Davis, kind of head up an advisory commission that would look at issues related to health equity and also work on the creation of a future Office of Health Equity. So the bill creates the office, the Advisory Commission on Health Equity, and it establishes the membership of this group. This would be an ongoing group with the short-term goal of providing guidance and recommendations as to what the office should look like and what the office should be doing, and how the office should be giving out grant money to different organizations doing health equity work. But then the commission, the advisory commission, would all ongoing responsibilities after the office is created. For example, advising the office. It says my internet is unstable. Can you hear me?
Yes, you're fine. You're fine.
And it would also have responsibilities looking at any proposed policies in the state and how they would impact health equity, providing advice to the legislature and to other departments and agencies about how policies might impact health equity. There's also a piece in this to have the advisory commission look at training of professionals.
You're gone. You're gone, Katie. Now
Can you
you're
hear
back.
me?
Now I can hear you.
Okay.
We heard everything you said. Right up to
Okay.
training professionals, and then
Okay, great.
yeah.
So there's also a piece at originally there was continuing education language to train professionals to be more culturally competent and to use racism practices within their healthcare practice. And so now the commission is going to be looking at that issue and providing recommendations.
Okay. Yeah, I remember when I read the bill initially, the CEUs were in there for different groups, and I thought I was hoping that might shift so that they'd have a better view of what that should be. But okay, all right. This is great. I think that's good. I don't think we have to go through the child advocate right now. As you said, it's still in the process in the committee. So these three bills we get a picture of what they are. So any questions, committee, on those three? Good. It sounds like these are going to be some interesting bills to pick up and work with. They aren't all going to be easy. I do hope that we get these because it's our jurisdiction. Anything else, Katie, or are we good? You're frozen. So I guess we're good. We're good. Okay. We love the internet. It sets our agenda for us. We have 2 minutes left. I just wanted to share with you that I have put a proposal amendment in for H315. It is the section 11. Jen wrote it up for me this morning. It's section 11 from S117 that the House removed on the immunization registry, and allowing for information from that registry to go to the VHI, Vermont Health Information Exchange, and then for for that data to be shared with other states when it is confidential, no identifying information. So that's a proposal amendment. Yes, ma'am, Senator Hardy.
Thank you. I think I'm glad to hear you're doing that. Did you ever get a sense from the House as to why they took that out of 117 to begin with?
Yes, I did. I did. I had a conversation. I think a couple things. One, I don't think they fully understood the implications of the proposed amendment of that proposal. And I think the word immunization just raised some, it raised the red flag for groups that around vaccination. And so it just apparently, and I can't speak for the House committee, but they had some real difficulty in circling back and fully understanding what was actually proposed in the amendment. So I would like to say I give our committee, all of you, tremendous credit for taking the time to understand it and to do it right. So, but the House, it's unfortunate. I did talk with Representative Lippert. He is interested in trying to ameliorate the problems that came up. So we'll see how it goes.
Great, thank you.
All right. Anything else? Jen, anything else on that okay, we're good. I don't know whether I'll be going into appropriations on it. I know Senator Ballin is very interested in having this amendment go forward, having heard from the Department of Health and the significance of the data sharing. So especially during the pandemic. So can I say that our committee supports it? Do you support my proposal of amendment?
Yes.
All right, good. I thought we've already been through it, so that's good. All right, anything else? Thank you all. I'll see you early tomorrow morning at 9 o'clock, with or without breakfast, and we're all set.
I'll just eat on camera.
No, yeah, that's fine. Look at when